The following episode of Southern Remedy deals with the subject matter of HIV/AIDS in Mississippi and contains information that some viewers may find graphic. It's intended for mature audiences only. Viewer discretion is advised.
What I'm doing here today is actually to tell my testimony, my story on how to maintain a healthy lifestyle with HIV.
Dad, he had told me that he was going to get some burial insurance just in case I die.
It could have been me that infected him, or it could have been him that infected me, because neither one of us were virgins.
After I found out that my diagnosis was HIV positive, me nor my partner actually seek treatment.
My name is Marcus McPherson. I'm 29 years old. I'm currently a graduate student at Jackson State University. I'm studying public policy and administration. I've been HIV positive for 2 years now. It was just a regular, normal, what I thought to be normal test. I went to the clinic and got tested, Crossroads Clinic in the medical mall. Got tested because I hadn't been tested in a while and just decided to stop in and get my checkup, and that's how I found out. I had been getting tested before I moved back to Mississippi, but once I moved back to Mississippi, it kind of lapsed for probably about almost a year. I was shocked. It took me a while to process it. I was smiling and everything with the nurse at first, and then it was like as soon as the nurse left out of the office, I just broke down into tears, and I had to just sit in the little exam room just for a while before I could even leave and go home. I gained my composure just enough to leave out of the doctor's office and get to my vehicle. I basically sat there in the parking lot for about 20 minutes before I could even put my key in the ignition and start it up to drive off to even call anybody. And the first person that I thought to call was my best friend. I told him that I was HIV positive. I just found out. He reassured me that everything was going to be okay. He just wanted to make sure that I was doing okay, and after talking with him for a little while, I was finally able to regain my composure and eventually drive home. My parents are married. They have been married for at least 40 years now. So I actually have two older brothers. One passed away a few years ago, so that made me and my oldest brother real close after his passing. So he was actually the first person in my family that I told. And then afterwards, I think it was probably after 6 months or so that I told my parents, because the main thing on my mind, I did not want them to worry about me, because I knew that they had already lost one child. I didn't want them to think that they were going to lose another child. My brother was shocked at first, but he saw that I was managing my care. I was going to my doctor's appointments. I was taking my medicine like I should and everything. So he got over his initial shock very quickly. My parents, on the other hand, they were kind of upset a little. My mom cried. My dad was like, "Son, you're gonna be okay. We're here for you if you need us." And basically, they have played a supporting role. I've started a strict diet, a vegetarian diet. Basically, it's eating healthy, exercising, taking my medicine. The same thing that a lot of doctors tell their patients, I make sure that I follow. A lot of people look at me and said, oh, it's because of your diagnosis that you lost weight. It's actually not that. I lost weight on purpose because, you know, diabetes runs in my family, high blood pressure runs in my family, high cholesterol runs in my family. I had a brother who passed away from a heart issue, and I'm just trying to make sure that I take on a healthy lifestyle. I want to live. That's my main thing. I don't want to be the person that dies early. I guess it kind of cemented when I first found out I was positive. I met a lot of people through a support group here in Jackson, and over the short period of time, several other guys that I met when I first started going to those support groups have passed away because they were not taking care of their health. And that is one of the things that has kind of shocked me and made me really focus on taking care of my health care and making sure that I do what I need to do to stay around for 20, 30, 40 years and have a long, fulfilling life. At first, they were in shock, sort of like I was, in disbelief. And now my family is kind of like Sylvester's mom. They're worrying about me. They're always saying, well, you okay? You feeling okay?
It's more like a family instead of a group, just a group of guys that come. We do invite new guys in, but with, you know, HIV, you still got that fear factor. You know, even though I'm HIV positive, you come into a meeting where everybody else is HIV positive, but you're afraid of who you might see.
How's everybody doing?
One of the things that was evident is that HIV prevention, providing access to prevention and care services, you know, to the people who were most affected by HIV was important. And in some of our studies, we found that not having health insurance was actually a significant risk factor for HIV infection. That not having a primary care provider was a significant risk factor for HIV infection. That even if you, as a gay man, went to a primary care provider, not being able to disclose your sexual orientation was a risk factor, probably because people was not able to receive any kind of HIV prevention education. And so it was kind of evident that as a solution, one of the solutions to, or one of the ways to address this HIV epidemic and the STD epidemic was actually to provide access to clinically and culturally competent healthcare services. So that's kind of the reason why I've been involved in the past 2 or 3 years, developing, helping, you know, clinicians and helping, you know, health centers to develop culturally competent services for LGBT populations, and certainly, you know, Open Arms is kind of the flagship, I guess, you know, of that effort.
I've been HIV positive, knowing it for 9 years now. I initially found out in March of 2005, and probably wouldn't have gotten tested then had it not been that my partner of 6.5 years, he was, you know, they did a blood drive at his job. So when his results came back, well, the blood, how they test the blood, they told him he needed to go get checked. So when he got checked, he was positive. So me being his partner, I had to go get checked as well. After I found out that my diagnosis was HIV positive, me nor my partner actually seek treatment. Basically, we ignored it, you know. And I moved away. At this time, we was living in Texas. I moved away a few months later, moved to Memphis. And, you know, while I was in Memphis, I was going to the doctor, but not for HIV. I'm a diabetic. So I was going to the doctor, and I never told them that I had HIV positive. They never tested me. And a year later, that's when I began to start feeling weak, losing weight. And it was June 6th of 2006 is when I got very, very sick and, you know, came home. That's when I got a phone call that my partner had passed away.
We're talking about people who are young, who to a certain extent, I mean, until a few minutes ago, felt, you know, invincible. And suddenly you're telling them, you know, they have a disease or a condition. I mean, I try to avoid actually calling it disease, unless they have any symptoms. A condition that is incurable. And, but also is a diagnosis that is charged with so much, stigma and blame, and they ask themselves, what I did to deserve this. I mean, and so you have to help them to go through the process of dissociating or being able to identify the feelings that are associated with the fact that you're being told you have a disease. I mean, when you're 21, 22-year-old, and now you have a disease that you never thought you were gonna have. And second, what component of what you're feeling is actually derived from the guilt and the homophobia and things that you have actually learned, being, kind of like taught to you through your raising and the cultural context in which you grew up, that probably are going to become important barriers for you accessing healthcare and for you, staying in healthcare and being able to comply with your medical treatment.
Dr. Mina, he really made me feel comfortable. He let me know like what's going on. I can always get in touch with him. He's not one of the doctors where it's like impossible to talk to or get in touch with him. He really do help. My name is Antwan Matthews, attending Tougaloo College, majoring in biology. What I plan to do after college is be a healthcare administrator. I found out I was HIV positive April the 24th, 2013, so next month I'll make a year.
A few days later, I went to the hospital. They sent me home, and my mom came to Memphis and went back to the hospital, and that's when they kept me for 13 days. And about 3 days afterwards, the doctor came and told me that I had a fungus. I really don't recall what kind he said that was in my stomach, and it was the results of AIDS. While I was in the hospital and the doctor told me, he was like, we don't have to tell your mother. But I was like, we need to tell my mother, because I need prayer. So when my mother came back in the room and the doctor had left, and I told her that they found out what was going on, and her thing was, she always called me boy. So she's like, boy, you're gonna be okay, God got you. But she was always there. She stayed in the hospital the entire time I was there. When I got out, I remained in Memphis for a week, and then she came to Memphis and got me, and I stayed with her. And it was like me being a baby all over again. She had to take care of me, and she didn't treat me no bad way other than just that. I just get emotional every time I tell that story, because I think about what my mother did for me, and then a lot of the people that I encounter, how their family pushed them aside.
My dad is a preacher. When I told my dad, it did go through my head that he's gonna judge me and this and that, but at the same time, I was like, you're the man of the Lord, so the Bible, and judging is something that he really don't too much praise. So that's the reason I was like, okay, I'm gonna tell him. And when I told him, the first thing, he was like, this is a disease, and you're gonna die, and this and that, and so many words. That was how he was coming off, but I had to let him know that HIV is not what it used to be in 1980s. It's 2014, It's that time where we finally realized that we can better ourselves if we take our medications and if we do all these things to stay healthy. If we don't, then that's when the numbers will change. So I had to show him, and when he get to talking negative, I would let him know God has the last say so. So right now I'm not really too much worried about dying. I'm talking about living.
My name is Javon Bean. I go by Zai. I've been HIV positive for 5 years. I actually been in a relationship with somebody for about 1 year and 7 months, and of course we getting tested and everything with each other, and basically we transitioned into not using condoms, and come to find out within, I said last month that we was dating, that he was cheating on me with somebody else and brought it back to me. I told my mentor and also my spiritual father, Cedric Sturtevant, and that was the first person I told. He could relate. He was in the same position as me, and then of course he told me several times be careful, be careful, be careful, be careful, be careful.
He came to me and he told me that he tested positive for HIV. And it broke my heart, but I didn't let him know right then. You know, I just talked to him and I told him that, you know, we're gonna make sure he getting care. And he's just like a biological son. You know, if ever I had a son, he's just like, but most of them are, you know. I get the same love from them that I get from my daughters, and my daughters are biological daughters. So, and they know the guys, they know their brothers, as they call them.
Mom, she hung up the phone basically after I told her. Didn't come back for a little while, but she finally called back, and we had really just talked about it. She just always say, take care of yourself. Dad, he had told me that he was going to get some burial insurance just in case I die. So, really and truly, just kind of I told you so kind of moment.
I couldn't imagine being rejected by my mother at all. Even when I told her that I was gay, I could not imagine if she would have rejected me, you know, I don't know. So, but I just want people to just show more love toward each other, you know. If that's your child, you know, God bless you with that child. Love him or her, regardless of what goes on in their lives.
The ignorance that the church has had in the past of assuming that if we can point to someone's behavior as the reason for what they have, then all of a sudden we do not have to care or have concern for them, which I think is not biblical, which I think is not practical, and not what Jesus would do. And so today I tried to point out that even when Jesus encountered the man at the pool of Bethesda, that was a man who had done something to get there. But Jesus' first words to him were not words of judgment and condemnation. They were words that offered help. After he received the help, then Jesus gave him some words of how not to get there again. And that's the paradigm for the church. Help first, point in the new direction second.
Anytime you attach HIV and AIDS with any individual in Mississippi Delta, you are pretty much an outcast. So with that being said, what we're trying to do is just starting dialogue in the churches. Once we get the pastors to step out of their comfort zone and speak about sex and HIV and AIDS, then we can have more conversation on how to fight the disease. But until we do that, it's going to be hard to dismiss the stigma.
The pandemic of HIV and AIDS is significant and serious throughout the world, and it is critical in the African American experience and the African diaspora. So number one, we're doing what Jesus would do, because I think if you were to equate HIV with the leprosy of Jesus' day, we have to follow his example of how to deal with that. And so it is a major issue, and it's a major issue because it's also a very preventable disease if we will address both the personal responsibility issues and the systemic issues that lend themselves to us seeing where HIV is and how it is growing.
Well, there are definitely ways that Alcorn continues to teach people about getting tested, and there's a place on campus, but we want to help them make better ethical decisions, and if they do receive it, you know, provide care and counsel for them.
We're doing different outreach in the community first with the Bolivar County Baptist Association. So we're going to start with those steps, and then we're going to go into the churches.
I do believe homosexuality is sin. My message to the people of faith is abstinence. Be faithful. My message to the people of humanity is, if you have another ethic, at least protect yourself so that you can protect the human family.
After crying and all of that, I just got myself together and started thinking of a plan. I decided to come up with a health club, which I started at Tougaloo College last semester. And the health club is Tougaloo Healthcare Educators. Health stands for helping, educating, advising, learning, teaching, healing. And what we do, we're an awareness group on all diseases. So it's not just HIV, it's not just breast cancer, it's thyroid disease. We do different diseases each month. So that's what I decided to do. Instead of just sit back and blame everyone for my problems, I decided to take actions for my own problems and do something.
You know, to be responsible.
Well, you have to understand, as a bisexual person myself, that still lay down with a woman that knows my story and that knows what I do outside of that household, truth will set you free. My name is Eric Lee Bailey. I'm from Bolton, Mississippi. I'm 34 years of age. I've been HIV positive for approximately 15 years now. Ole Miss, I will be at the LGBT Law Symposium, but I'll be there to talk about HIV in the state of Mississippi, encouraging people to go get tested, making sure that they have resources in the Delta area, Memphis area, and on back up to Jackson where they can go. I'll be providing phone numbers for them, I'll be telling my story, and I'll be taking questions and answers from some of the professors and or students that may be there at that particular time. But when they run across my profile, it has my status, HIV positive. And next thing I know, I started going into advocacy work, then started being an advocate, which I started leading with the Mississippi Health Department with Caring Services. I became a community co-chair there. After that, I started working with Grace House, which is a transitional housing for people living with AIDS and or HIV.
What are the biggest myths about this?
Kissing. Oh my God, kissing. Really? You know how much saliva, how much longer a long kiss will have to be. You'll have to start kissing today, and then probably in 2020, you might have a little small strain to come through.
And you have to have some blood present, and it has to have a route. So it's not as simple to contract HIV as people think. But I don't want people to go out there and just be all willy-nilly, especially because there's some medications out there. Because what we hear the most, we have medication.
Yeah,
I'm gonna be good.
Well, then you have some stats from.
I
started doing this work volunteering in 2003.
And these are stats from 2012, December 31st, 2012. The age group 13 to 24 with HIV disease, we have 561 new infections.
Didn't know my dad had died from complications due to AIDS. I thought he died from cirrhosis of the liver because he was an alcoholic. And to find that out, I knew then I was where I was supposed to be. And I just like helping people. I love helping people.
What I'm doing here today is actually to tell my testimony, my story on how to maintain a healthy lifestyle with HIV. Because I always have to remind people, HIV live with you. You don't live with HIV.
My name is Vanessa Hassel. I have been HIV positive since 1998. I am a peer counselor here at the Southeast Mississippi Rural Health Initiative Clinic here in Hattiesburg, Mississippi. I do rapid testing for potential people who may have been exposed to the virus. We meet with positive people and we give them a meal and we teach them about, living a positive life, being positive. In here, we're empowered. These are condoms. These can make the difference between HIV positive and HIV negative. And as a woman, we encourage them to get the condoms. You gotta think outside the box. You don't wanna teach infidelity. No, we're not teaching it and we're not promoting it, but what we are is sending a message that you need to protect yourself. I worked at Forest General Hospital for 18 years. In that, I met a gentleman and eventually we got married. I was switching jobs because I wanted to work 8-hour shifts so I could have more time at home. I had to do a physical for Hattiesburg Clinic. And that's when I found out that my test was positive. So initially I didn't tell anybody. And at the same time, when I was finding out that I was positive, my husband had some issues going on with his health. And so I kept insisting that you go to the doctor, go to the doctor. And so finally, when he went, I asked him just do a whole panel on him. He was HIV positive. He said he's in what they call the ARC. And that's a term that the old physicians used to use, where it's like right at the doorway for having AIDS. I tell people, when you marry, you don't know what all it entails. And the way I was raised was, it said for better, for worse, that means you had to be there. And so when it got worse, we just decided, well, we together, we gonna be together. I didn't go through blaming him or he blaming me, because overall I still loved him. And honestly, it could have been me that infected him, or it could have been him that infected me, because neither one of us were virgins. I just took him as he was. And so my love for him was real, because like he said, he always, before he left, he always told me, he said, I thank you for staying. I was thinking to myself, where was I going? I mean, I loved you. I loved you. So you were always good to me. You were always good to my kids. My family loved you. So, we're a team. And that's what we chose to do. Women need to understand that it can happen to them. We are not, elite from this. It can happen to you, because we as women, we love with our hearts. And that's one of the things that, I learned if we would have had the conversation. Because when a gentleman opens the door for you, or he does the things that you feel you need for that comfort, then you're not looking at, okay, where have you been? How was your past relationships? Those are questions that need to be asked. I mean, it doesn't make you less of a person, because sometimes men get on the defense about that, but as for women, you gotta love yourself. You gotta love yourself the most to say, I'm gonna ask these questions, because that one encounter can affect you for the rest of your life.
Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center.